Today we are evaluating a classic case of canine hypoadrenocorticism, also known as Addison's disease. Hi, my name is Anna Smith and I'm a veterinarian. This condition most commonly affects young to middle-aged dogs, and it is more frequently seen in females. Certain breeds, such as standard poodles, Portuguese water dogs, and West Highland white terriers, may have increased risk, but any breed can be affected. The clinical history is often non-specific and chronic, with intermittent or recurrent clinical signs. Owners may report episodes of vomiting, diarrhea, lethargy, decreased appetite, and weight loss. These signs may improve temporarily and then return. In some cases, patients present in an acute, life-threatening condition known as an Addisonian crisis, often triggered by stress. Physical exam findings depend on disease severity. In mild cases, you may observe lethargy, mild dehydration, and weak pulses. In more severe cases, especially during an Addisonian crisis, hypovolemic shock and pale mucous membranes, prolonged capillary refill time, and bradycardia, which is abnormal in a hypovolemic patient and suggests hyperkalemia. These findings may appear more severe than expected for a primary gastrointestinal condition. Problem list: recurrent vomiting and diarrhea, lethargy and weakness, dehydration, possible hypovolemic shock, and bradycardia. Laboratory abnormalities may include hyponatremia, low sodium, and hyperkalemia, high potassium. The sodium to potassium ratio is typically less than 27, along with mild azotemia. There is also an absence of a stress leukogram. Differential diagnoses include acute kidney injury, gastroenteritis, pancreatitis, parasitic infections such as whipworm, and toxin exposure. Whipworm causes diarrhea and electrolyte imbalance. A definitive diagnosis requires endocrine testing such as the ACTH stimulation test, which is the gold standard. Additional diagnostic tests include baseline cortisol measurement. A value greater than 2 micrograms per deciliter makes Addison's unlikely. We also perform serum electrolytes, a complete blood count, and a chemistry panel. An electrocardiogram, if hyperkalemia is present, may show bradycardia with peak T waves or widened QRS complexes, and a fecal float to rule out whipworm infestation. For an acute Addisonian crisis, start intravenous fluids, specifically 0.9% sodium chloride to correct imbalance. Administer glucocorticoids like dexamethasone initially, as it does not interfere with ACTH testing. Manage severe hyperkalemia with calcium gluconate for cardiac protection and dextrose with or without insulin. Chronic management involves mineralocorticoid replacement using DOCP at an initial dose of 2.2 milligrams per kilogram. The frequency is typically every 25 to 30 days, administered intramuscularly or subcutaneously. Our monitoring protocol includes rechecking electrolytes at 10 to 14 days after the first injection. Day 12 is the peak of DOCP. If hypokalemia or hypernatremia is presented, DOCP dose should be decreased by 5 to 10%. Recheck again at 25 to 30 days before the next dose, adjusting the interval based on levels. If on day 25, hyperkalemia and/or hyponatremia is presented, the DOCP dose frequency should be decreased by 1 day. Glucocorticoid supplementation with prednisone or prednisolone is typically 0.05 to 0.2 milligrams per kilogram daily. Remember to increase the dose during periods of stress such as illness, surgery, or travel. At the day of surgery, give prednisone 2 to 4x the maintenance, 0.2, 0.5 mg kg, or 0.1, 0.2 mg kg of dexamethasone. Monitor serum electrolytes, renal values, hydration status, body weight, appetite, and energy level. Monitoring is more frequent initially and can be reduced once the patient is stable. The prognosis for Addison's disease is excellent with appropriate and consistent treatment. This is a lifelong condition, but it is well controlled with medication and essential regular monitoring. Missing doses can lead to life-threatening complications, but most dogs return to a normal quality of life. Owners should be educated to recognize early signs of relapse and seek care promptly. Thank you for watching.